So during the duration of me being on dialysis, I've had two grafts. I've had to I got the first one initially, and then I had to have another one like replace that one. But I've had a bunch of revisions. So that first picture that you're looking at here, that I first got the graft, right? Like I first got it. There's no real track marks on my arm. It's like brand new. And that little nub at the end where the hinge of my elbow is, that was really problematic for me, and it was just a thing that the more I did dialysis, the bigger it got. So I would ask my nephrologist at the time. Ironically enough, it's the same nephrologist that tried to deter me from transplant and just would try to indoctrinate me into just being happy with being on dialysis. It's the same doctor. So I asked him, because he was a doctor surgeon. I at the time, I was starting to see more of that, like doctor surgeons. They diagnose and they do the surgery. At the time, I didn't, I was just realizing that was a thing. And he was a doctor surgeon. And he looked at it and he said that there was nothing that he could do. It's just a thing that's just, and it's just going to get bigger and bigger, and there's nothing I can do. I can't make it smaller. There's nothing I can do about it. So I'm like, is there anything that you can do? And he was like, no, that's just how it is. Oh, well, too bad. Your arm is just going to look like that for as long as you have the graft. So I'm like, of course that this one guy is going to say something like that. So I did some transferring around from center to center, and ultimately I ended up with a new surgeon. And it's the same surgeon that I've made videos about before. Her name is Dr. Loja, and she's fantastic. So I had her look at it, and she said, oh yeah, I could do something about that. Just like that. Now, she made a revision, but eventually it just came back. But some events happened where the graft stopped working. So she's just like, look, this is what we're going to do. We can't save the graft. The graft is done. So what I can do is we can just put in an entirely different graft made of like bovine valve. So we're going to put that in. I'm going to shave off this. I'm going to redirect this. And then the lump that you see, completely gone. Now there's a little bit of protrusion here. It'll be like that. It's, it's a high volume area. I'm using it for dialysis. But the lump never came back. It just stayed pretty consistently kind of smooth to make the arm look relatively as normal as possible. Now, I say all this to say this. It's okay to get a second opinion. If you feel like whoever your care provider isn't giving you the consideration that you want, and they're not doing their due diligence to try to help you the best they can because they're reserving that for other patients that they feel like have futures and that have, actual lives, then you can just switch. That's what I did. And it saved me my arm. With this particular doctor, the longer I had him as my nephrologist, the more I was thinking, the more I started noticing things of like, man, this guy doesn't really want me to succeed at anything. He just wants me to just be in this space always. The sort of like passive aggressive, like, you're never going to get this, Carl. You're not going to get it. So you might as well just give up and just be comfortable and be happy in this space, because this is as far as you're ever going to go, for whatever his reasoning was. But getting a second opinion and possibly not being afraid to switch doctors, you may find the perfect fit for you.